I'm Dr. Sujata Mohan from Rajan Eye Care Hospital. I'm a phaco-refractive and corneal surgeon. So today we're going to talk to you about a S.M.I.L.E laser. What is S.M.I.L.E laser? S.M.I.L.E laser is a refractive procedure which is done to correct the power in the eyes. So how does it differ from LASIK? Because we are all very familiar with the word LASIK, which has been going on for more than 20-30 years. So what is now different? So the difference is in LASIK, there is a flap in which after creating the flap, the laser is done in the intrastromal space. Whereas in S.M.I.L.E, there is no flap, there is a very small incision through which a lenticule or something very similar to your glass power is created within the corneal stroma and it is removed through the lenticule. So the advantage of being without a flap is you don't have to worry about the flap dislocation, not touching the eyes, not rubbing the eyes, and even after a long time, even after 10-15 years, the chance of flap dislocation which can happen in LASIK does not happen, and the eye is one single unit because the lenticule is removed through a very small incision, which is actually the short form of S.M.I.L.E, which is the small incision lenticule extraction. So the correction is as good as LASIK. You get excellent results for all myopic patients. However, patients who have plus power cannot undergo this procedure. So that may be one of the downsides of S.M.I.L.E. Whereas in LASIK, even patients with plus power can have laser correction done. But S.M.I.L.E can correct myopia as well as astigmatism as effectively as LASIK was doing. And not only that, the safety factor is very high with S.M.I.L.E. There are a lot of studies also which have been done that show that the dry eye which can happen after LASIK is very much reduced or almost insignificant in S.M.I.L.E when compared to LASIK. The reason being the large incision in femto-LASIK actually can cut the corneal nerves and cause the dry eye. So it takes at least 6 months for the dry eye to recover. Whereas in S.M.I.L.E, the incision is very small, about 3 millimeters. The number of corneal nerves cut are very less, so the dry eye factor is very much reduced. And the other important thing which the studies have emphasized is the corneal biomechanics, or the strength of the cornea, is very well maintained with S.M.I.L.E when compared to other procedures such as femto-LASIK. They say that it is equivalent to what we do with the surface procedures such as PRK, where we do not take a flap but we do the laser in the second layer itself. So S.M.I.L.E is a great advancement in refractive surgery which gives excellent results for the patient and makes the whole job easy for the surgeon because the downtime is very less for the patient and also the number of post-operative visits are very much reduced. On-table time is also reduced. So considering all this, S.M.I.L.E is the way to go.